Hey guys, let us continue with our clinical shots. So in this question, we can see a picture showing different movement or cuts of a vocal cord, right? So there are numerous pictures where you can see the vocal cords in different positions. The first question that we encountered is, what is the procedure shown in this image? So basically they wanted you to know what is the procedure being done in this image for this patient. So this is basically a test called stroboscopy, right? So in stroboscopy, what we do is, this is a procedure of imaging of vocal fold movement. So we visualize the vocal fold movement very finely. How? By giving the light in a strobe form. That means what we do is we give flashes of light at a slightly slower speed than the mucosal waves of the vocal fold, and what it does is it let us to see the rapid movement of vocal fold more clearly, right? So it let us to identify even the subtle anomalies of the vocal fold that would otherwise be very difficult to visualize by a normal endoscopy or laryngoscopy, right? Like if you see, to visualize a fan movement, if you flicker a torch light to the fan, you will observe that the wings or the blades of the fan, you can visualize their movement. If you want to experiment, you can switch off the light of your room in night and just flash the torch light over the fan which is rotating. You will observe that you can visualize the blades of the fan, which is not normally visualized as such, right? So this is a very nice test to know the different vocal cord pathologies and different structural anomalies, right? How does this work? We have discussed that we give flashes of light to visualize the vocal fold movement, and what is the advantages of using this procedure in evaluating voice disorders. So the main advantages of this technique is an ability to slow down the movements of vocal cord so that the pathology can be easily identified, and with the identification, what you are doing is recording of such abnormalities. That means medico legally also you are safe, you are recording whatever finding is there, right? So main parameters that we record is the degree of glottic closure, symmetry of vocal fold movement, periodicity of mucosal wave, amplitude of mucosal wave, the quality of waveform. So many a times when there is pathology inside the vocal cords, it is not visualized as such. Then when we do stroboscopy, we will see there is abnormal mucosal wave, so that will give us a hint of intracaudal pathologies, right? So there are different pathologies which we can diagnose with stroboscopy in a better way. Now moving to our second question, here you can see a laryngoscopy image where a 60-year-old male smoker presented with hoarse, breathy voice for 4 weeks. Initial endoscopic examination is showing the following image. So from the history, we know that he is an old age man who had smoking as a history and presenting to us with a hoarse, breathy voice for 4 weeks. So this long duration of breathy voice, smoking history led us to do this examination, endoscopic examination of larynx, and here you can see some peculiar findings, right? So this is your right vocal fold, this is your left vocal fold. You will observe that both right and left are not equal and there are some abnormalities. Now let us come to the question, what do the images show and what is the next best investigation to perform? So if you observe very finely here, you will observe that your left vocal fold is lax. That means there is bowing of left vocal fold and there is vocal fold abduction in this case, and or vocal cord abduction, and in another is there is adduction. So basically your left vocal fold is not normal, or you can say that there is a left vocal fold palsy. Why we are saying this? Because right seems to be normal, but the left, once you ask the patient to make voice, you will observe that this left will not move and the right is only the one that is moving. So they ideally should give a video clip, but even then, if you see a static image, you will see a shortened vocal fold with a bowing or something, and this is the normal vocal fold, how it looks like in a laryngoscopy. But the left one is something which is suspicious or a provisional diagnosis of left vocal cord palsy. The second question was, what is the next investigation that you would do? So you would do a CT scan, and if I ask you why, The reason for why is to see any pathology along the course of vagus and the recurrent laryngeal nerve. So you know that the vocal fold movements are supplied by the recurrent laryngeal nerve and or the external branch of superior laryngeal nerve, or you can say that from the branches of vagus nerve. So you would do a CT scan starting from the base of his skull till diaphragm, right, in order to not to miss any pathology, from the base of his skull, right where the vagus is emerging, till the diaphragm. So course of left recurrent laryngeal nerve, you all know that it is much longer than the right recurrent laryngeal nerve, and the reason is very obvious. The right recurrent laryngeal leaves the vagus at the root of neck, whereas the left recurrent leaves the vagus in the chest cavity and then loops around the arch of aorta before traveling back to neck, and that is why the left recurrent laryngeal nerve is much longer than the right recurrent laryngeal nerve and is more prone to injury or more prone to damage in case of thoracic surgeries or thoracic tumors, right? Now, iatrogenic injury, that means as a result of any surgery like thyroid surgery, cardiothoracic surgery. So the most common cause of this type of palsy is iatrogenic injury, followed by malignant invasion or metastasis from lung, thyroid or head neck tumor. So vocal cord palsy can also be attributed to malignancy, iatrogenic injury, and some more causes like post-viral illness, neurological diseases, and blunt trauma. Okay. Now the treatment. So treatment is individualized and determines based on the patient's functional need and demands. We will usually start with voice therapy to educate patient how to use proper technique to compensate the voice, and finally surgical intervention, which may involve vocal fold injection for medialization or reinnervation surgery. So there are different type of thyroids, means thyroplasty, that you should know, type 1 2 3. So let me know in the comment all the type 1 2 3 4 what all thyroplasties you know, and then we'll post the answer in the comment section. So it was good practice to adopt a wait and watch policy for the first 6 months, and if the spontaneous cord function returns, then it's okay, but if it doesn't, then we go for better options like surgeries and other thing, right? So this was the two cases that I discussed in this part, in this short session. For more, you can download our free app, that is Medex, and get connected with me at 8840804798. So this is my WhatsApp number. You can ping me there. I'll add you to the NEETPG and INICET update group. This is Dr. Shivam. Hope you all are doing well and you are daily pushing your limits to achieve your maximum, because I have faith in you that you would perform to your optimum. Stay healthy and stay happy.